Hello everyone, welcome to ITLS Academy. Our lecture is Sterile Pharmaceutical Products. This is part 2 of our lecture. In part 1, we have already covered many sterile pharmaceutical products like injections, intravenous infusions, etc. Left out things in sterile pharmaceutical products we will cover in this particular lecture. So let's start. Ophthalmic preparations. We are going to see ophthalmic preparations as sterile pharmaceutical product. Definition for ophthalmic preparations is they are specialized doses. As ophthalmic, as the name indicates, they are related with eye. So, they are specialized doses form designed to be instilled onto external surface of the eye. These are topical, administered inside or intraocular or adjacent or periocular. We can say there are three types of ophthalmic preparations. First one, that is applied on the external surface or topical. Next one, that is administered inside the eye, that is intraocular, or adjacent, that is periocular, to the eye or used in conjunction with an ophthalmic device. The most commonly employed ophthalmic dosage forms are solutions, suspensions, and ointments. The newest dosage forms for ophthalmic drug delivery are gels, gel-forming solutions, ocular inserts, intravitreal injections, and implants. So, for the sterile ophthalmic products, we are going to see a design philosophy. Medication intended for instillation onto the surface of the eye is formulated in aqueous solutions as eye drops or lotions, or in an oily base as an ointment. Next point, since there is a very poor blood supply to the anterior chamber, defense against microbial invasion is minimal. Furthermore, it appears to provide a particularly good environment for growth of bacteria, as well as being sterile. Eye products should also be relatively free from patients or particles which might cause damage to the cornea. As you can see, this is the outer layer of the eye. It is known as cornea. Next point, another type of sterile ophthalmic product is the contact lens solutions. However, unlike the other types, this is not used for medication purposes but merely as a wetting, cleaning, and soaking solutions for contact lenses. Eye drops. Eye drops are presented for use in first, sterile single dose plastic sacs containing 0.3 to 0.5 ml of liquid. Second, multi-dose amber fluted eye dropper bottles including the rubber teat as part of the closed container or supplied separately. And the third one, in plastic bottles with integral droppers. Although a standard design of bottle is used in hospitals, many proprietary products are manufactured in plastic bottles designed to improve safety and care of use. Next point for eye drops is, in order to lessen the risk of eye drops becoming heavily contaminated either by repeated inoculation or growth of resistant organisms in the solution, the use is restricted after the container is first opened to 1 month. The period is shorter in the hospital environment because of the greater danger of contamination by potential pathogens, particularly pseudomonads. Next point. Finally, eye drops for use during open eye surgery must not contain a preservative because of their cytotoxicity. Single dose preparations are therefore ideally suited for this purpose. Now we are going to talk about eye lotions. Eye lotions are isotonic solutions used for washing or bathing the eyes. They are sterilized in relatively large volume containers. Although they may contain a bactericide if intended for intermittent domiciliary use for up to 7 days. Next is eye ointment are prepared in a semi-solid base. For example, simple eye ointment PP, which consists of yellow soft paraffin 8 parts, liquid paraffin 1 part, wool fat 1 part. The drug is incorporated prior to sterilization if heat is stable. or added aseptically to the sterilization prior to the sterilization. Finally, the product is aseptically packed in clear sterile aluminum or plastic tubes. Next is contact lens solutions. Most contact lenses are worn for optical reasons as an alternative to spectacles. Contact lenses are of two types, namely hard lenses which are hydrophobic and soft lenses which may be either hydrophilic or hydrophobic. Contact lenses are potential sources of eye infection and consequently microorganisms should be removed before the lens is again inserted into the eye. Next is wetting solutions. These are used to hydrate the surfaces of hard lenses after disinfection. They may be isotonic with lacrimal solutions or lacrimal secretions and be formulated to a pH of about 7.2 for compatibility with normal tears. Cleaning solutions. These are responsible for the removal of ocular debris and protein deposits and contain a cleaning agent that consists of a surfactant and or an enzyme product. Since they must also cope with chance contamination, they contain a preservative. These are isotonic and have a pH of about 7.2. Soaking solutions. These are responsible for disinfection of lenses but also maintain the lenses in a hydrated state. Finally, heat may be utilized as an alternative method to disinfect soft contact lenses, especially the hydrophilic types. Lenses are boiled in isotonic saline. Dressings. Dressings and surgical materials are used widely in medicines, both as a means of protecting and providing comfort for wounds and for many associated activities such as cleaning, swabbing, etc. It is also important to appreciate that sterile dressings must be packaged in such a way that they can be applied to the wound aseptically. Next point, a very important aspect of dressings production is packaging. The packaging material must allow correct sterilization conditions. Correct sterilization conditions means, for example, permeation of moisture or ethylene oxide. Retain the dressings in a sterile condition and allow for its removal without contamination prior to use. Implants. Implants are small sterile cylinders of drug inserted beneath the skin or into muscle tissue to provide slow absorption and prolonged action therapy. Compression of sterile drugs must be conducted under aseptic conditions using sterile machine parts and materials. Next point in implants is the absence of a lubricant increases the difficulties of making tablets. The hardness of the implant is difficult to regulate, which consequently leads to variation in the rate of drug release. One comes here, molds. This is L, molds. Note that if the melting temperature is high enough to the interior of implant, the implant will automatically be sterilized by this process. Absorbable hemostat. The point is the reduction of blood loss during or after surgical procedures where suturing or ligature is either impractical or impossible, can often be accomplished by the use of sterile absorbable hemostat. The four main types of absorbable hemostats are: number 1, oxidized cellulose; number 2, absorbable gelatin foam; number 3, human fibrin foam, and number 4, calcium alginate. The principal mechanism of action of these is the ability to encourage platelet fracture because of their fibrous or rough surface. Sterilized surgical catgut. This consists of absorbable strands of collagen derived from mammalian tissues, particularly the intestine of sheep. Next point. The official method is to pack the plain catgut strands up to 350 cm on a metal spindle in a glass or other suitable container with a tubing fluid. The purpose of which is to maintain both flexibility and tensile strength after sterilization. There is minimal loss of tensile strength and the container can be overwrapped prior to sterilization to provide a sterile container surface for opening aseptically. Non-absorbable types. The first point is sutures and ligatures are also made from many materials not absorbed by the body tissues. Depending on the physical stability of each material, they are preferably sterilized by autoclaving or gamma radiation. Next point. They are packed in a single-use glass or plastic containers which may contain a tubing fluid with or without a bactericide. The different materials, that is non-absorbable types, are described in detail in the British Pharmacopoeia, and this is in the 1993. Instruments and equipments. The method chosen for sterilization of instruments depends on the nature of the components, what types of components are used, for the manufacturer of the item and also on the design of the item. So the method of sterilization will depend upon the components and design. These are main important factors for the sterilization decide. The wide range of instruments that may be required in a sterile condition includes syringes, and these syringes may be of glass and plastic disposable syringes, needles, giving sets, metal surgical instruments like scalpel, scissors, forceps, etc. Rubber gloves, catheters, etc. Relatively complicated equipments such as pressure transducers, pacemakers, kidney dialysis equipment, incubators, and aerosol machine parts may also be sterilized. This is a new and developing field of medical technology in which many factors may have to be considered before the choice is made as to the most appropriate methods of sterilization in any particular situation. So thank you guys. Our session ends here. We have completed all the sterile pharmaceutical products. These are completed in two parts. If you haven't watched our previous lecture, then you should watch the part 1 before studying this part 2. So thank you for watching. Stay connected with ITLS Academy. Guys, follow ITLS Academy on Instagram, Facebook, Twitter, YouTube, WhatsApp, and also on LinkedIn. That is a major job providing platform in India. For latest videos and updates from ITLS Academy, you can subscribe ITLS Academy on YouTube. For easy access of ITLS Academy, you can get the app of ITLS Academy from Google Play Store. So thank you very much for watching. If you like this video, then like, share with your friends, and also subscribe our channel ITLS Academy. For any help or query, you can call us our helpline number 7080-833-450. You can also reach us on our website, that is www.itlsacademy.com. Thank you very much again for watching this video.